Welcome back to our continuing conversation with Todd Keitz and, of course, my co-partner Joyce Griggs around patient advocacy. When you are helping somebody else, you are the advocate for them. And we're fortunate to have back again Todd Keitz. And Joyce, can you just give a little intro for Todd?
Absolutely. Todd, thanks so much for coming back again to the stream. We're really happy to have you to talk about what does it mean to be, a patient advocate when you're also the caregiver for your family member, your loved one, whoever that is. And I just wanted to let everybody know who Todd is. And, you really were in a situation where you had to make some choices, some hard choices about 4.5 years ago. So you have been on this caregiving patient advocate journey for your parents. And that caused you to have to make some career choices as well, which I know couldn't have been easy. And I'm sure a lot of people in our audience can really identify with that because of the impact that this, being a caregiver can have on all aspects of one's life. And so in that, you've now kind of created a new career for yourself, and you are creating services, a suite of services really, that's geared to caregivers and patient advocates. And we're just so delighted to have you back to kind of talk about these important issues and the things that you have to offer, of course, as well.
Thank you so much. I'm thrilled to be here. Thanks for having me back.
Yeah, of course. Should we move into the topic of patient rights?
Sure.
So what do we mean by that, first of all?
Well, I know that's a hot topic for you, me, and Tracy. Patient rights. Wow. So there's the AHA has their patient bill of rights. We'll start at that level and then drill down from there. So I always implore patient advocates, caregivers, patients, families, check that out online. Go and look at what that is and understand you have a right. You have a right to your information. And sometimes it may be a challenge because you might have to push to get it and it doesn't show up. But it's at that level. But then if we go down to another level, each hospital also typically or healthcare setting has their own patient rights. It's often an offshoot of the AHA patient rights. But overall, I just say learn those, and that's a start.
Yeah, I agree. I think that would be the place to start. You mean the American Hospital Association?
Yes. Sorry, I know I'm using acronyms. Yes,
I know. And there's a lot of them. So it's the American Hospital Association Patient Bill of Rights.
Exactly.
And we'll include that in as a link when we post the show, for sure.
Yeah. Mm-hmm. Along with that, I want to say there's an important individual or individuals to know within a hospital system, and they're called ombudsman. And so I've had to a couple of times contact an ombudsman because I wasn't getting the information that was rightfully for my parents and for me as the power of attorney and the healthcare surrogate. You never want to get to that point, but if you need to, it's important to know that there is somebody there.
Mm-hmm. So it's sort of like a legal person that can help you, right? The ombudsman. It's not the same thing as the patient advocate in the hospital system.
Right, it's separate. I would say they're quasi-legal.
Quasi-legal. Yeah. In that they'll help you get stuff, right? Like paperwork.
Exactly. They'll help you get the stuff that's not being fed to you.
Not being fed to you. The patient advocate in the hospital system or in a hospital would be the person that could help you get care. Like if you weren't getting the care, somebody wasn't following up with you or something like that. So just,
Yeah. Just a real brief, the example being 3.5 years ago, my mom was in the hospital and was not getting the information from a doctor in the hospital that is rightfully ours to know what is going on. And they didn't want to give it to us until they got to a certain point in the process. And I said to the doctor, that's not okay. And they still said no. And so I had to go to the ombudsman person.
And you got the information then?
Got the information then. Yes.
So, that's just like an important lesson, I think, for our audience, is that, especially when, the white coat comes to us and says no, our knee jerk, I'm putting myself in this bucket. Maybe it's not
Yes.
everybody, but it's like, okay, doctor said no. And then you have to say, okay, the doctor said no, but doesn't mean the answer is no. I need to keep going and advocate for myself and my loved one, because this is my information. This is my health. This is my life. So
That's such a great point, and it's
Yeah.
such a great point, and it's one I make all the time too.
And
Yeah, go ahead, Tracy.
yeah, I was just going to say, I think this goes into the next topic of building rapport with your healthcare professionals, but finish your thought. I'm sorry.
Yeah, I was just going to basically second that notion, which is, understandably, we see the people in white coats, and again, 99+% of them are wonderful. They're there for a reason. They care for their patients. They took the Hippocratic Oath, et cetera, et cetera. But there are going to be times we're all human, and there's personalities that just aren't going to work. And so try not to be intimidated by that white coat, and understand that you have a right, which then leads into, how do we communicate with them?
And, I just want to give an example from my little journey. I began to learn, some doctors, they may be brusque. They may not have the best bedside manner, but they are the best person for the job. So I was willing to, I began to understand that sometimes I had to look past that. They're not there to be my friend. And it doesn't mean that they weren't empathetic, but their empathy isn't as forward. So, I always felt, I have to make friends with them. But, how do you feel about that?
Yeah, that's a really good point. I've had to learn along the way as well. One of my mom's key doctors can be that way, can be brusque and short and not listen. So I've had to learn how to navigate that, and it can be a challenge too, because it can change from time to time. And so it is. I agree with you completely. I want the best doctor. I want the person that I feel is going to be best for my mom or for my dad. If they're not, if they don't have the greatest bedside manner, okay, I can look beyond that, as long as they're open to the conversation.
Right.
And because, as we all know, and why we're all sitting here, is the patient knows themselves. The patient really, it's about the patient. It shouldn't be about the doctor.
Right. Right. And I think, to Joyce's point earlier, we have been trained as a society that code gives a level of, I don't want to use the word authority, but sort of, it means, they know everything. And of course we know that that's not true. Because if they knew everything, they'd be able to treat you right away and you'd be cured. So there is a bit of learning curve for society to kind of change that opinion. It's not about challenging the medical establishment. I mean, you don't want to do that. They do have expertise. Otherwise, why would you be seeing them? But the reason we're all here is to say they don't know everything, because they don't know about you.
Right. One thing I've learned along this journey is the communication aspect with them. Now, I've always thought I was a good communicator, and I still believe I am. I can have my challenges and moments too. We all can. But one of the things is, and it's hard in an acute situation because there's just things going on, but I always try and come from the aspect of what we've been talking about, is that they have hundreds and hundreds of patients. They have so many situations and things they're trying to follow. We have one or two, let's say, to keep it simple. I always try and keep in mind when I'm talking with them, of trying to put myself in their shoes.
Right.
My God, what they must be dealing with, and so forth. And I will say to them often, especially in person when there's meetings, I know you have so much going on and so many patients, and I really appreciate, really appreciate you and really appreciate the time you're taking with my mom.
Mm.
It just decompresses most of the time. It decompresses them because they're human. So you're giving them this positive feedback, and it has to come from the heart. I mean, it's so important to come from the heart and not from just, okay, I'm saying this because it's just something I have to say. They'll feel it. And so that's the first thing that I would say in terms of communicating with them, is try and put yourself in their shoes. Understand they have a lot going on as well as you.
Right.
And then when you want to bring information to them or ask them questions, say, I really value your expertise on this. Can I share with you what I've learned in my conversations or my research? And so now you're asking them for their opinion based upon what you have found. And words are important.
Right.
And I'll say, it's my understanding from what I've read, that this might be an option. What do you think? And let them talk.
Right.
Yeah, it's sort of, what just popped in my mind is, there's the old adage, if you ask for advice, people are going to give it to you. But you shouldn't discount what you have learned or what you know. Yeah.
Right. I was in a situation, early, just a small, kind of major issue, but it was going to be taken care of. And I had done the research. I Dr. Googled it. And when we went in to see the doctor, I said, listen, I have Dr. Googled this. These are my concerns, about what I have seen online. Please take this with a grain of salt, but can you answer these questions for me and just allow me to know that this is not where we're headed, right? So again, just admitting that, yes, I did look things up. Now, there are going to be people like yourself, Todd, who have other means of research, right? So it's not just Googling. You've done some deep research. So there is that establishment, hopefully with the doctor who understands that you have done this type of deep research. And it isn't just like, hey, I looked this up on WebMD. So
sometimes we hear about doctors, they have a God complex. Well, if you go to an attorney, they have an attorney complex. It just depends. Everybody who's doing whatever, you've done this for so long that you have a great bit of knowledge. And I think what you said in terms of showing them that you're the amateur, so to speak,
right.
Makes them feel, oh, okay, well, they're valuing my opinion and they know where they are. They know that they're just looking at Dr. Google, so to speak. But they'll take that in easier.
Right. But then there gets to be the point where you have somebody, like I said, like yourself, who has done deeper research because you've been in it for so long. This could be somebody who is looking for clinical trials and is doing a little bit more research and may actually wind up being more knowledgeable. So how do you establish that communication when you actually may have a little bit more info?
Yeah, I will always still start with, hey, it must be really difficult. I know you're dealing with a lot of folks. That's the first thing, because I go to the human level with them. It's true, they are. And I would love to share with you, I have, one of my dear friends happens to work in oncology for Johnson & Johnson and has some great information on this. Can I share with you what they've shared with me? Ask for the permission.
Right. Okay, that's great.
Yeah.
That's great. Okay.
That's really, I like that. And I like this conversation about research, because I think it's important to do research that you may want to bring to the appointment, and in the book, in the two ways that we've just been speaking about it, either going deep into the scientific literature with citations from, credible journals that they're going to recognize, or the Dr. Google route, which is just going to be drinking from the fire hose of, amateur night on the web, which we all do. And then of course there's how do you research to educate yourself about the condition or conditions of your, of the person that you're caring for, right?
Yeah, I've researched a lot of conditions because of my mom's systemic scleroderma. That affects so many different things because she has lung disease, kidney disease. She has so many different things that are going on because of that. I'd say the first thing to do is when you learn about a condition, it's fine to go and Google. I mean, that's important. You
Right.
take that initiative. I would say go to the association that's most recognized in that area. Generally, they're going to have good information as a start. And then from there, you can then dig deeper. If you, Tracy, for instance, you were talking about trials. How do I look for a trial in this area? And you can then dig deeper through that. I would also, and not everybody has this, is keep in mind that okay, do I know anybody? Or do I know anybody who might know somebody? Try to not be afraid to ask for help.
Right.
So many people don't want to either put people out or they're not confident. They don't feel they want to bother somebody. This is your loved one's life. This is, try not, and I know it's easier said than done for folks. Yeah, just think about that because there are a lot of people out there who are willing to help. People want to, I find that generally people want to help.
Yes.
Absolutely. I talked to people about it's your moral support plus list with a plus sign. These people that who maybe somehow have had the condition, or they're an MD in a former life, or they're just good at doing the research, whatever it might be. Call upon people because people always want to help you. I mean, I've been in situations where people in my family have had very difficult diagnoses, and then I just put the word out to everyone I knew, and what came flooding back was short of amazing.
Yeah, humankind is interesting. We get so caught up with all that goes on in the world, but when it comes down to it, people want to help, and that crosses everything. It crosses race, religion, political spectrum. It crosses everything.
So we have two other topics to cover. One is insurance and the other one is legal.
Okay, those are both, they're both 2-hour long topics.
Yeah, exactly.
We'll touch on it. Insurance. So there's different aspects to insurance, and depends on who you're caring for. It truly is a whole topic for hours and hours of discussion, but at a basic level, understand. So I'll talk about parents of Medicare years. So it's one thing to understand, okay, Medicare, helping them understand what Medicare options there are and what supplemental Medicare options there are, because that's important. Without the supplement, there's going to be a lot of additional cost, and which often challenges families, individuals, and financially. So it's understanding what are the options and looking at them. So perfect time for this because open enrollment is now happening. So looking at the options, sitting down with your parents, your loved one, and saying, okay, this is what we have. What do we need? What do we anticipate? And you can only anticipate so much. You know what you're going to have, but you don't know what you're not going to have, which is the essence of insurance. So if you have a key person, an insurance person that understands health insurance, great, talk to them. There are people out there who still can help you with that. Talk to healthcare facilities. That's one of the things that I think is most important is, so in my case, Cleveland Clinic, I need to understand from a Cleveland Clinic perspective what they accept, and generally for what I anticipate is going to be needed for my parents. Because there's some programs that are not accepted. So it is a conversation. We could do a whole session on this for sure. But gather information, understand what you're going to need, talk to the healthcare systems that you're dealing with primarily, and do your best. It's hard. And there are consultants out there that'll help.
What about legal? What are the legal must-haves?
Right.
So the legal must-haves start before anybody's sick, ideally. We really need to look at what, aside from the last will and testament, need to understand, okay, a living will, durable power of attorney.
Yeah.
What is healthcare surrogate? Somebody have a DNR. What happens if somebody's in a situation like that? There are various documents to understand that are really important. I had to learn that when I first started helping my mom and subsequently my dad, is, okay, they had these documents together, but we needed to understand they were together, they had put them together well before they were sick. Are they still relevant? So it's important if you can get somebody to do an audit of those documents, if you don't already have them. If you don't already have them, look to do that for sure. And then understand that things may change over time with those documents. So it's not just okay, I did them this year, they're done. It's important to reassess those as time goes on. I will say, so for people who may not be able to afford that, and that's because that is a major majority of people who can't afford to pay an attorney to take care of this, is look to community resources. And so I'll go back to the resources I mentioned earlier, and there are plenty more, which is look to Catholic Family Services, Jewish Family Services, et cetera, et cetera. They often have attorneys that work pro bono, and that will help with that, at least at a basic level.
Right.
Those are great points. And one other thing that I'll just tag on to what you're saying, like your parents put them together in a while ago. They are documents, especially anything that has to do with a do not resuscitate or these advanced directives. Doctors will look at those, and if they haven't been updated in the last 2 years, just even with a signature that says, yes, we have re-updated these, we still agree with it, they may not find them to be valid. So just things to keep in mind. It's really important to get advice on these documents and keep them up to date.
I wanted to dovetail on that because it's really important to know that in addition to that, each healthcare facility also typically has their own paperwork that you're going to need. You can give them, like for initially with my mom, because she was hospitalized so many times, I carried with me the power of attorney and the healthcare surrogate, and they're like, well, we have our own paperwork. You need to fill that out. So keep in mind that does not always get you what you need to do.
Okay.
Yeah,
that's really interesting. Well, Todd, Joyce, thank you so much. We're barely scratching the surface on all of these. I'm sure we will have Todd back, and thank you very much for your time.
Oh, it was a pleasure. I love this. I know it's important to your audiences and as well as mine. So thanks so much.